The Charter Podcast, Episode 16, Common Health Assets, with Dr. Liam O'Hare and Dr. Karen Galway of Queen's University Belfast.
I'm Dr. Karen Galway. I'm a Senior Lecturer in Mental Health in the School of Nursing and Midwifery at Queen's University Belfast.
Hi, I'm Dr. Liam O'Hare. I'm a Principal Research Fellow in the School of Social Sciences, Education and Social Work at Queen's University Belfast.
So I'm the local principal investigator on the Common Health Assets Project. The Common Health Assets Project is a piece of work across the UK looking at the impact of community-based organisations, or community-led organisations as we call them in the project, on health and well-being. So that involves talking to a lot of different organisations. The project really is based on a lot of partnerships, organisations that have built up from community need, that are offering services in the community to the population of that community. So a very place-based project looking at how people benefit really from connecting with community organisations, how their health benefits and how the community as a whole benefits as well.
One of my hats is Director of the Innovation Zones at Queen's, and I suppose our work really is working closely with community organisations quite a bit of the time. So Karen kindly asked me to be a co-investigator on this project, and from my experience of working with community organisations, and the project to me is fantastic because it really is exploring the benefits of community-led organisations. And the two community-led organisations that we work with in the Innovation Zones are the Greater Shankill Partnership / the Greater Shankill Children and Young People Zone, and then the other one is the Colin Neighbourhood Partnership. And in fact, the Colin Neighbourhood Partnership is one of the community organisations that's heavily involved in the Common Health Assets Project. So it's really just an opportunity to learn from each other's experiences working with community organisations, and ultimately being able to show some evidence that the vast array of benefits that these community organisations bring to their local communities and the people within them, the children, young people, families, grandparents and everybody else in the community.
The partnership aspect of this project is really key. We've worked with the partners to examine just how we collect data and how we build the relationships required to collect data and to work with the people in the organisations in these communities. And for Northern Ireland, we're working with the Colin Area Neighbourhood Partnership in just outside Belfast. We're also working with Oak Healthy Living Centre, who are based in Lisnaskea, which is quite a rural area, so it's quite different to the Colin Area neighbourhood. And our third organisation that we're working with is the Bogside and Brandywell Health Forum, based right in the centre pretty much of Derry. So it's been amazing to work across those three organisations who really have quite different challenges to face and different health needs to address. Of course, inequalities in health is a huge area that the project is looking at as well, and we're really working with the organisation to find out what they do, how what they do works for people, and which people it works best for. So that could be people coming along to take part in, say, for example, a 6-week programme to learn a new skill or to get active. Or it could be as simple as the community organisation connecting by telephone to check in with an older person, see how they're doing. It could be also that people come along, take part in some of these activities, and then they themselves become a volunteer who maybe delivers activities. So there'll be this cycle of involvement that is just really lovely to build capacity in the community. And the more people that get involved, of course, the more the benefits can stretch to, as Liam says, the families, the children, the grandparents, and even at some of these organisations, local businesses would be involved. They would get involved in maybe sponsoring some activities, but also maybe just bringing people in for training and information sessions. So the wide range of activities going on, which actually makes it a real challenge to research this impact that we're trying to get a handle on, and we know about the impact, we know about the benefits because we're hearing it firsthand from people out in the community sector, people who run the programmes as well as the people who come along and take part in them. So we're hearing about these benefits, and our job really is to try and capture those in a consistent way where we can then say, well, here are the things that are working for these types of people, and here are the things that are working for these types of people, and how do we scale that up, and how do we influence policy to provide more funding for this kind of activity, which of course in the end will be taking pressure off the health service, because it's health promotion as well as health protection. And for some people, quite a number of people who engage with these organisations, it's health maintenance, because they may have long-term conditions that they're coping with, and others, with caring responsibilities. So it's a wide range of involvements that are going on across these different areas, and that's what we're trying to capture with our study.
The very exciting thing about this project is it's whole UK wide spread. So across all of the partners, the fact that there's links to policy makers in all of those jurisdictions at local and national level. So there's a huge opportunity to really influence policy in this area. Plus the fact that it's probably one of the first projects to really look at this on a national stage about the health benefits that community-led organisations are bringing to their local communities. So politicians are watching this project and will be watching for the results of this project to see how they can change policies in order to really maximise the benefits of these organisations. And as Karen said, it really comes down to the fact that statutory services are under pressure. Nobody knows their communities better than the community organisations in the communities. So it's economically a no-brainer really to invest more in community organisations who know best what their communities want in terms of health. So it's really a growth area, and policy is keeping a close eye on it. Plus, a lot of the people involved in this project are linked into policy structures. For example, here in Northern Ireland, we're linked into the Public Health Agency through the project. There's also the community organisations themselves are well linked in various policy areas. So it's that cycle really of policy, practice and research really working in tandem, and it's a really good example of how this can hopefully make a big change in this area.
Yeah, I mean, one thing to add to that is, or a specific example I suppose, is that in the UK now there's been a big policy push to increase capacity in social prescribing. So social prescribing is this idea of using non-medical interventions to address health needs. And so the idea being that you may not need to spend time with a medical practitioner. You may need help with social connections. You may need help to seek support, particularly relevant to people with long-term conditions, but also very relevant in the sphere of mental health, which is a massive proportion of GPs' work. So social prescribing allows people to connect to these community organisations to get support that isn't available in, for example, a 10-minute consultation with your GP, and can offer all kinds of benefits to reduce isolation and loneliness, but also just to connect with people is really a useful thing for health. So in terms of social prescribing, we have an element to our project, a PhD student, Jill Mulholland, working on this particular area and really drilling down into trying to see, well, in terms of the bigger outcomes of the project, what can we say about social prescribing? What can we say about people having a connection with a link worker as part of a social prescribing plan? And what can we say about the impact that has on people's outcomes when they're connecting with community-led organisations? So that's a really innovative part of our project. It's been a very difficult area to research, so it's very exciting to be able to add to that body of knowledge which is growing, and the practice is really running ahead of the evidence, and so we're hoping to try and do a bit of catching up with the evidence so that the policy can grow and be supported, and that concept, which again, is a bit of a no-brainer, can be rolled out and be strong and robust and done well.
It's really, just to reiterate that, like, Jill's PhD is at the cutting edge of some of the research going on in social prescribing in the whole of the UK and maybe even globally. So there's so many elements to the project that are fascinating. Like we mentioned policy earlier on, there's a whole strand of the work is about how this project can influence policy in the area of community engagement and health, community-led organisations engagement and health. So multiple other strands to the project, everything from creating theories and theories of change around this type of work to photo voice and lots of elements of community engagement. So we have lived experience panels. I don't know if you want to say some more about those elements.
Yeah, I mean, our lived experience panel is most definitely sort of at the cutting edge of involving people in research. So from each of our 4 centres across the UK, we have representatives who have benefited from the community engagement, who have come together to discuss their experiences and to respond to our methods in the research. So they can tell us which aspects of our data collection are going to be the most meaningful because of their own experience of being involved in community-led organisations. And we as a team are determined and very willing and very excited to be able to respond to that information and to have that proper cycle of lived experience really influencing how we analyse our data, how we translate that into policy and how we make it all make sense. It's actually quite a complex picture because there are so many different ways that people engage with community organisations that your sort of traditional research methods would struggle to capture that. So in using these realist evaluation methods, we're building what's called programme theory and then testing it with our data. So we're 1 year into this project at the minute and it is going really well. We're getting such good engagement from our community-led organisations, particularly here in Northern Ireland, and it's just been lovely. We're building relationships, we're using them for other things. We're trying as well to allow this project to give us extra added value. For example, I had a social prescriber from Bogside Brandywell Health Forum deliver a lecture to our undergraduate nursing students. It's an added extra that we're getting from building these relationships and working in partnership, and it's just lovely. It's really enjoyable, and you can see the benefits. You can see that by building those extras in, everyone gets something out of that, and therefore, research is really just a series of asking favours of people in a way, and so when you can reciprocate that and work both ways, the work comes together, and our team is doing really well. We're really pleased. It's an ambitious project, I suppose. There was a little bit of anxiety around how this would work, but it's working really well. And our lead, who's based in Glasgow, Professor Rachel Baker, has been an excellent lead, and she's bringing us all on this journey together, and everyone's learning along the way. So it's been really good fun to work on as well.
Just to extend that point a little bit, the fact that the innovation zones have been operating here in Northern Ireland for over 6 years has already built substantial relationships with community-led organisations like Common Neighbourhood Partnership, and we were just reflecting on it today about how smoothly data collection and how quickly and problems are solved because of the existing relationships that are with the organisation. So every day and hour and year invested with an organisation, produces multiple benefits going forward. And for research, I suppose it's an ethical issue that we have to be really conscious of our responsibility when we're working with communities, that we go in and that we're not just going in to collect data and then go off and leave it as we found it. There's a real obligation to make sure that the research that we're doing is bringing real benefits to the communities that are helping us with this research. And there's quite a few examples of that, and some of the ones Karen has talked about there already. But it's a two-way pipeline. we're benefiting, but the communities need to benefit as well. And we've already got some projects we're looking at in terms of elder care and various other spin-out type opportunities that the community are really interested in. I suppose that's one of the underpinning philosophies of the innovation zones, is the idea of interdependence, is that we have shared goals and shared values around things, and you can't work those out unless you take time to talk to the community, establish where the shared areas of interest are, and build on those areas. And if you do that shared work, then you get to be a little more critical with each other in some senses, where you can challenge each other because you've got a relationship that can take the strain a bit better. So generally, higher education, academia and researchers having partnerships and relationships with communities is a very powerful structure to operate with. And by the end of this project, Karen, we'll have several more communities that we've established those relationships with, and who knows where the benefits can run longer term from that as well.
Yeah, certainly now as a mental health researcher, I can see there are so many gaps in our knowledge around what works best to keep people out of hospital, to keep them well, to keep them active, to keep them economically active. You know, there's an economic argument behind a lot of this work that it makes so much sense to help people to make a valid contribution in life. It's obviously good for self-esteem, it's good for confidence, but it's also good for the economy, and it's also therefore good for the communities as a whole when people can be more active and just be shown, maybe taken by the hand a little bit in order to show their own worth and their own ability to contribute. And I mean, that's a lovely thing to be part of. I suppose the flip side of that is that in collecting our data, there are a lot of quite sad stories. There's a lot of people who really were quite lost before they found the connection with the community-led organisation. So, you know, the good outcome of that is that they did find the community organisation. And I suppose, you know, part of the work I'd be interested in doing would be to look at how we connect more people to community organisations in a way that interests them. You know, not one size fits all, it just doesn't. And that's why there's such a variety of work going on in these organisations. And it's very inspiring. It's very inspiring in the whole to see that at the individual level, the broader UK level, policy level. You know, it's all got so much to offer. And in a way, sort of seems like, gosh, why has no one done this before? So it's quite pleasing to be the one who gets the opportunity to do it. I feel very privileged to be part of the project, and to have Liam on board as well, and all the team. It's a lovely team.
We have Aileen Gilday as a research fellow on the project, who's multiple years of experience working in schools, communities, and health services. She
really has the ability to build those relationships down to a T, you know, being able to work with different audiences and get the message across. It's quite a honed skill, and we're very, very lucky with our team in that way. Aileen's fantastic.
It's another example of when you're doing social-based, community-based type research, you can't follow a manual or a protocol. It takes years and years of experience to build up the ability to be able to work in these environments, and having the innovation zones give us a bit of a head start in some respects, but then also a really experienced team who know what they're doing to do this kind of work. And then across the UK, the teams are also at the forefront in their own jurisdictions really of this type of work as well, you know. It's a massive team actually.
It's a massive team.
And if you look at the Common Health Assets webpage, it'll give you
all the rundown.
It'll give you who are all the players in this project, both in the community level and at the academic level. There's also, it should be noted, like it's a NIHR funded project, so the National Institute of Health Research, so it's the premier funder of health research here in the UK. And that's another reason why it's being monitored probably by the policy makers, because the NIHR feed a lot of their information into the way policy is shaped in the UK. realist evaluation would also be a fairly novel approach for the NIHR, so that's the first time they're really dipping their toe into this kind of methodology for this project.
Yeah, and I guess it's really pleasing that they've taken the risk on that. In a sense, there's always risk with trying new things, and the NIHR have funded this massive project using novel methods that wouldn't normally sit in the medical health research realm. So that's really pleasing. That's a mark of their confidence in the team to deliver on this project.
It's also the fact that, as Karen mentioned earlier, in some sense the practice is ahead of the evidence in community-led organisations and their health benefits. So funders are taking notice that this is a place where we need to quickly gather some rigorous evidence, and the fact that they've pulled together such a great team to be able to do that is it's a great opportunity, and personally I'm delighted to be involved with such high esteem individuals in this particular field.
Absolutely. I suppose one thing to notice about this project is the timing. In terms of COVID, this project really couldn't be better timed. Now, it didn't feel that way when we started because COVID was getting in the way of progress for us as a team. But as time went on, and as we watched to see just how busy these community-led organisations were through the whole of the pandemic, it became very obvious to us that we've got to get started on this project. We've got to capture some of this activity, because it wasn't the statutory services who were jumping in to bring food parcels to people and to deliver things to their houses. It was the community-led organisations who had the nimble ability to respond to need in our hour of need during COVID. So the fact that we are rolling this project out just in the tail end of the worst of the pandemic means that we are able to report on some of that activity that was going on. Now that's really important because, like I say, the statutory services struggled, of course they did, to cope with the need during COVID. Anything that was community-based was in peril from the point of view of the NHS services, and so it was absolutely vital that these community-led organisations existed and were able to respond. So we've been able to capture some of that, and that then can feed into the results of our study. And quite a lot of the organisations appreciate that they were able to do it. They wanted to do it. It was their instinct to just step in and provide some of that extra support that was needed at the time. But unfortunately, some of the extra resources that they were afforded to do that have now been pulled. So there's a perilous scenario with these organisations that sit in the community as well, and that is around sustainable funding. So it's something really important that we can report on, that we can talk to the policymakers about just how much that impacts on what they are able to do. And I think that's a really important strand of our work.
I suppose a phrase that sums up a lot of that work is the unsung heroes that are out working in communities. And I have the great privilege to work with those community organisations for a long period of time, and to see the passion, commitment and just selflessness that goes into keeping the show on the road, particularly in disadvantaged communities and deprived circumstances. There is no service you could put together to keep that show on the road. It's passion and devotion, dedication to communities that keeps those organisations going. And to be able to report, as Karen says, on that and sing some of the praises of these organisations, I think it's underdone and needs to be done more. So hopefully this project will see more sustainable funding and appreciation, and we can maybe provide some of the evidence of the benefits to outcomes that these community-led organisations are having, which is crucially important.
For more on this project, visit Queen's University Belfast's Innovation Zones page, go.qub.ac.uk/innovation-zones, and follow the link to our work. For more in this series, visit our webpage go.qub.ac.uk/charter-podcast and follow us on social media @QUB Engagement.